Welcome to my channel. This is Bruce the Boss, and the WHO, aka the World Health Organization, is urging everyone, including those who've been fully vaccinated, to still social distance, wear a mask, avoid large crowds. By the way, if you're not yet subscribed to this channel, please go ahead and smash on that subscription button, like this video, comment on this video, share this video. All right, let's get into the article. Straight from CNBC's article here, the World Health Organization, aka the WHO, urges fully vaccinated people to continue to wear masks as the Delta COVID variant spreads. So the World Health Organization on Friday urged fully vaccinated people to continue to wear masks, social distance, and practice other COVID-19 pandemic safety measures as highly contagious Delta variant spreads rapidly across the globe. As Dr. Mariangela Simano says, and I quote, "People cannot feel safe just because they had 2 doses. They still need to protect themselves. Vaccines alone won't stop community transmission. People need to continue to wear masks, consistently be in ventilated spaces, hand hygiene and physical distancing, avoiding crowds. This still continues to be extremely important, even if you've been vaccinated, when you have community transmission ongoing," end quote. So this is the World Health Organization's recommendation as the Delta variant continues to spread across the world, regardless of whether or not you've been vaccinated. Now, I will leave a link in the description box below for you to check out the article itself. I'll probably leave a couple of others so you can get multiple sources. But basically, the question then becomes, when does it end? Even if you've gotten the jab, apparently you still have to do all of the same precaution. Nothing changes. I would recommend everyone go ahead and consult with your doctor, your personal physician, to decide what's best for you ultimately. But again, I just want to ask the question to my subscribers and or those who are watching: at what point does this all end? Was it ever meant to end, or is this all part of the World Economic Forum's agenda, 2030 agenda, and drive other businesses out while the 1% will continue to rake up billions as they've been doing, as small businesses have been crushed? Meanwhile, retailers have just been racking up record profits. Individual rights taken away for the greater good. Governments have been able to extend their power indefinitely and implement a lot of policies that otherwise wouldn't have never passed. And you're also seeing a change in the workforce and what it is they're willing to take, all because of what's been able to transpire over the past year. So I'm just asking the question, at what point does it end? What's the point of doing certain things if we're still going to be at square one? Is this a battle that can be won? A lot of people make the argument, if we just did X, Y, and Z, this will be over. Is that true? Was that ever true? Or is this something that we're just going to have to live with for the end of time, much like influenza, aka the flu? Was this ever something that could just disappear entirely, or was that just a pipe dream sold? I also want to ask a question: what about countries like Sweden that never imposed certain restrictions, and yet their numbers are still comparable to other countries that did lockdown, like the UK, like France? What about states like here in Texas, and or more specifically Florida, that actually led the charge and took the lead really early in September of 2020, removing all restrictions prior to the jab being even available and already, and are seeing great levels of success per capita, especially compared to other states in the United States like New York and or California, Pennsylvania, New Jersey, and so on. What about those states? Will we ever get to a point where we regress backwards to a point where various countries around the world enforce very restrictive measures and take away on one's right under the guise of, for your protection? Will the people allow it? Or will countries like Sweden and or states like Florida and or Texas stay the course that they have been doing? It's going to be interesting to see. Again, I just say, ask the question, consult with your doctors. Another great question to throw out there as well is, as far as, let's be honest about the demographics, this is something that everyone can get, yes, but does everyone get affected the same and are at the same percentage? What are the demographics? Are cases equal to hospitalizations and or symptoms? They can talk about cases spiking, cases rising, but what percentage of those cases are asymptomatic? I just want to post a question out there, because if cases are spiking and let's say 90% are asymptomatic but just caught because of individuals who are just regularly testing and or know someone else who tested positive, so they get the test themselves just to see they test positive, but again are asymptomatic throughout, is that the same, and are we treating cases the same as symptoms? And then for those who do contract symptoms, are they mild or moderate or severe? That's another important question we need to ask, because that does matter, that does make a difference. They talk about also long-term effects. Want to ask the question of, okay, what percentage of individuals who test positive end up with long-term effects? Are we talking about 50%? Or are we talking about 1%? Or are we talking about less than 1%? That's a question I want to pose out there for everyone to just ponder about, think about, especially when you start talking about supporting various measures to try to curtail this. Does it match up with the facts? And it's all about checking with the CDC, the World Health Organization, and also consulting with your doctor to know what the facts are and how it applies to you. But I just say that this was probably never going to end, never supposed to end. A lot of countries got drunk on the power that this has granted them. And then even the media, especially social media, have been also allowed to run amok and censor under the guise of protecting the masses, protecting individuals from misinformation, because all of a sudden it became a matter of life and death that required them to censor and remove content and or information that counters the singular narrative, therefore allowing others who aren't as informed and or research, who rely solely on their media, solely on social media as well, for their information. Of course, they're going to see a singular message when all other forms of information, even if it comes from medical professionals, practicing doctors and or scientists, get removed. So that's the video. That's the story. Again, if you're not yet subscribed to this channel, go ahead and smash that subscription button, because there are voices that are actively being suppressed, but your engagement allows in the countering of the suppression in YouTube algorithm and or the, I guess, big tech as well. Don't forget to like this video, comment on this video. I want to know your thoughts, all of your thoughts to some of the questions I just posed. This is Bruce the Boss Brooks, and I'm out. Peace.